American period. In 1899, the Philippines was occupied by the Americans. They introduced the new educational system, new health methods, and religious freedoms. In the year 1902, the epidemic of bubonic plague, cholera, and smallpox was rise. In the rising of those epidemics, the civil government was created Insular Board to coordinate and supervise private institutions engaged in welfare work. This agency was composed of government health officials and therefore affected important programs in the health field, such as the regulation of practice of medicine and the establishment of provincial and health boards to oversee the health programs of the government. The Insular Board also provide subsidy to expand the service of certain hospitals and asylums which were under its supervisions, like the Women's Hospital of Manila, the Hospicio de San Jose, St. Vincent de Paul, St. Paul's Hospital, and San Juan de Dios Hospital. In the year 1908, the Philippine General Hospital was established. On a permanent peacetime basis. Between 1921 and 1923, the chapter established health centers in provinces and dental clinics in schools. In the succeeding years, it came to be a soundly established social welfare agency. In 1907,
laws requiring any person, corporation, organization, or association desiring to solicit or receive contribution for charitable or public welfare purposes to secure a permit to do so from the Director of Public Welfare. In 1924, the Associated Charities had become an independent agency under the supervision of the Public Welfare Commissioner and was being partly financed by the government and partly by the private contributions. In the same year, the Philippine legislature passed a law, Philippine Legislative Act No. 3203, relating to the care and custody of neglected and delinquent children and providing probation officers for them. The Boys and the Girls Reformatories under the City of Manila became the Philippine Training School for Boys and the Philippine Training for Girls, and were placed under the supervision of the Office of the Public Welfare Commissioner.
In 1926, some of the children in a government orphanage in Makati were transferred to the Welfare Bill, a 50-hectare compound in San Felipe Neri, now Mandaluyong, Rizal, supervised by the in an experimental housing project of 51 model houses in Tondo. He also encouraged to the Associated Charities, designating it as the Insular Relief Agency to provide material assistance to the needy, elementary education, and the handicrafts trainings to those who would otherwise be out of school, and training in social work. The latter was done with the help of Josefa Mjara Martinez, who had obtained a diploma in social work from New York School of Social Work in 1921, worked for the Public Welfare Board, where she had started to introduce the scientific approach in social work, and then has detailed associated charities. The Morphy administration's social welfare programs marked the first time the government assumed full responsibility for the relief of the distress due to any cause.
In 1930 and 1940 was abolished and replaced by the Department of Health and Public Welfare. Congress convent in its first regular session on July 9, 1945. It was the first time the people representatives have scheduled on July 4,